This video demonstrates the principles of operation for Accuro's SpineNav 3D technology and a demonstration of how to use Accuro for guidance of epidural and spinal anesthesia. First, orient yourself with the ultrasound scan plane and how it intersects the spine anatomy when imaging in the transverse orientation. As the Accuro is scanned along the spine, the ultrasound beam will intersect alternating spinous processes and interlaminar spaces. The spinous process may be identified by the dark triangular shadow that it casts within the ultrasound image, and the interlaminar space by its U-shaped bone structure. The 3D Spinal Navigation mode assists with identification of the spine midline and indicates its location by a dashed line in the 2D ultrasound image and the lateral position of the 3D spine graphic. The Accuro is centered over the spine midline when the dashed line and the 3D spine are in the center of the screen. To assist with aligning the Accuro with midline, these graphics track left and right as the device is translated or rotated away from the spine's midline. The Accuro automates the measurement of the depth to the spinous process tip and the epidural space and displays these depths as blue and orange numbers within the 2D ultrasound image. When the ultrasound beam intersects a spinous process, a blue outline of a spinous process is displayed on the 2D ultrasound image, and the 3D spine indicator shows alignment between the target and the spinous process. When the ultrasound beam intersects an interlaminar space, an orange outline of an epidural space is displayed on the ultrasound image, and the 3D spine indicator shows alignment between the target and the epidural space. When aligned with an epidural space, note the angle of the ultrasound beam relative to the spine anatomy. This angle is the same angle that should be used to advance the needle to the epidural space. To summarize, there are 6 steps for using the Accuro to assist with epidural or spinal anesthesia placement. First, identify the spine midline and center the midline indicator in the middle of the screen. Second, while maintaining midline, scan along the spine to identify the desired interlaminar space. Third, take note of the depth of the epidural space indicated with the orange depth reading. Fourth, take note of the angle of the Accuro relative to the spinal anatomy. Fifth, disengage the Accuro locator to mark the needle insertion location. Sixth, advance the needle from the center of the locator markings and with the same angle as used to acquire the image of the interlaminar space.